Hello everyone, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University with a joint faculty position with Ross University School of Medicine. And in this video, I'm going to be going over social determinants of health. But more specifically, I'm going to be talking about social determinants of mental health. Now these were, this was written by Dr. Jeste and Dr. Pender, and I want to start off by saying this. There's these recommendations for research, training, practice, and policy are, of course, critical and especially important to consider in the context of mental health. But it is especially important that specific examples are provided of different types of interventions that have been effective in the past. So they start off by talking about public health interventions and social factors being identified specifically in ancient Greece, but this not being a central focus until in 1998. So again, SDOH is the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect health. Functioning, well, that affect health, this is important, functioning and quality of life outcomes. So early childhood development, education, job opportunities and income, racial and ethnic and other forms of discrimination, housing, transportation, and neighborhoods, and access to clean air and water, and to quality, affordable health care. All of these are a whole gamut of issues which arose from COVID, which were existing already in society, but with the COVID-19 pandemic was made a lot worse. Substance use disorder, serious mental illnesses became more frequent, and half of all lifetime cases of serious mental illness and substance use disorders actually start by the age of 14. The median age of onset of anxiety disorders and impulse control disorders is around 11 years, with a range of between 7 to 15 years of age. So there's a lot of different ranges that you can look for as it pertains to mental health, but 90% of adults with substance use disorders begin substance use during early adolescence. So the childhood emergence of psychopathology severely impacts the quality of education received. So it's important to what's the theme here? It's important to take into consideration substance use at an early age if you're thinking about social determinants of mental health, and so this actually overlaps into talking about how this goes into training and practice and policy. So there's, you can look at this from an individual perspective, but before that, expanding the concept of social determinants of health to include and incorporate mental health, you have to specifically address important targets as it pertains to mental illness. This is why I'm going to read out these seven uniquely and disproportionately affected areas. So the first one is a pervasive stigma against serious mental illness and substance use disorder. Number 2, a lack of parity and reimbursement for mental health care. So mental health services are not easily attained, and when they are, there's not as much coverage. A seriously flawed criminal justice system that ignores the contributions of poorly treated serious mental illnesses and substance use disorders to criminal behaviors. Of course, homelessness is very difficult. And then, of course, social isolation that I've published on previously, and loneliness. Actually, one of the former prime ministers of the United Kingdom talked about how loneliness is high in pandemic proportions, is in epidemic proportions. Next, talking about social media with hurtful communication leading to high stress and suicides, especially among youth. And positive social determinants, including positive childhood experiences, social connections, and community level resilience, social engagement, and social support exemplified by movements like the compassionate communities. I wanted to talk a little bit about the compassionate communities by visiting a specific website. This is a partial, at least, of compassionate communities, and I can try to expand this a bit so that you can see. But motivated by the ancient and universal golden rule to treat others as you would like to be treated, communities of people across the globe have recently committed to making compassion a driving force with a measurable impact on community life and on the well-being of all members of a community. So there was a charter for compassion that was started by Karen Armstrong in Minnesota, and the compassionate community includes the needs of all the inhabitants of that community recognized in that. So the motivating factor is compassion, a framework for getting started. There's actually 4 phases of this. Those 4 phases are discover and assess, focus and commit, build and launch, and evaluate and sustain. So those are the phases, but in fact, there's quite a few steps embedded within the phases, and which is interesting. And I know part of this is cut off, so let me fix that. So this is step 1 in phase 1, and this is identifying discomforts in your community, those issues that are causing pain and suffering to individuals or groups of the entire community, which can be addressed and relieved through compassionate action. So this goes through and talks about, for instance, in homelessness, isolation, and depression experienced by elderly, immigrant population, or youth who are pressured to be part of a gang culture. These are all examples of difficulties facing people in the community, and that could easily affect health. Maybe your work with the community's youth as an educator, a counselor, or in recreational services. You have you provide promise of youth, as well as understanding the difficulties that they may face in a rapidly changing world. Maybe there's hazardous materials in your area, providing for quality, affordable childcare, anti-bullying programs in schools, or compassionate care for veterans in your city or town or neighborhood. There's additional projects in here that they talk about, for instance, the Forgiveness Project, and then in step 2, you find out what is already being done or has been done to address issues in your community, learn what has worked and not worked, and recognize and acknowledge those successes. So the first part is, of course, identifying the problem, and then the second step is to see what has worked, and then looking to invite people to join you in assessing your community, including community leaders, as well as those informal leaders of other community constituencies that can give voice to the needs of the community. So you want to invite people that actually represent the community and can be strong advocates for the community. And this takes place, for instance, when there's maybe a business that's trying to take over a residential area, or maybe a highway is being built through an area where there's residents, and so a lot of times you need people that represent the community in order to represent all sides. So this keeps going into, again, phase 2, focus and commit. That's analyzing challenges and opportunities from information gathered during discover and assess phase. And then step 5 is based upon prioritized choices, create a plan to move forward, including specific short-term and long-term objectives, action plans, and anticipated outcomes. And then they need to be similar to SMART goals, where they're purposeful, measurable actions toward fulfilling your objectives. And good to have time frames on that. Register your campaign, step 6, with the Charter for Compassion. Participate in the global movement by making use of the Charter's resources, conference calls, newsletters, website research such as toolboxes, stories, readings, and bibliographies. Step 7, encourage partners in your community to sign on the Charter and to join in the community efforts. One of the things that I wanted to highlight, instead of just reading through these, it's important, this Charter, Compassionate Community Charter, is an important portion of this, which is interesting to note. So this Charter for Compassion is something that may be important to look at before we look at different parts of this. So we have transitioned to the Charter for Compassion, so that when we talk about it in the other document, we know exactly what this is about. Religion has been actually identified as one part of wisdom. And so thinking about the Charter for Compassion, there's actually some interesting portions of this. Looking at the Charter for Compassion, the principle of compassion lies at the heart of all religious, ethical, and spiritual traditions, calling us always to treat all others as we wish to be treated ourselves. Compassion impels us to work tirelessly to alleviate the suffering of our fellow creatures, to dethrone ourselves from the center of our world and put another there, and to honor the inviolable sanctity of every single human being, treating everybody without exception with absolute justice, equity, and respect. It is also necessary in both public and private life to refrain consistently and empathically from inflicting pain, to act or speak violently out of spite, chauvinism, or self-interest, to impoverish, exploit, or deny basic rights to anybody, and to incite hatred by denigrating others, even our enemies, is a denial of our common humanity. We acknowledge that we have failed to live compassionately, and that some have even increased the sum of human misery in the name of religion. We therefore call upon all men and women to restore compassion to the center of morality and religion, to return to the ancient principle that any interpretation of Scripture that breeds violence, hatred, or disdain is illegitimate, to ensure that youth are given accurate and respectful information about about other traditions, religions, and cultures to encourage a positive appreciation of cultural and religious diversity, to cultivate an informed empathy with the suffering of all human beings, even those regarded as enemies. And then we urgently need to make compassion a clear, luminous, and dynamic force in our polarized world, rooted in a principled determination to transcend selfishness. Compassion can break down political, dogmatic, ideological, and religious boundaries. Born of our deep interdependence, compassion is essential to human relationships and to a fulfilled humanity. It is the path of enlightenment and indispensable to the creation of a just economy and a peaceful global community. These are interesting. So this can be used as a type of charter to explain better and use this for interventions that can improve the community. And so this is part of all of the steps that I'm reading, and registering campaign for this Charter of Compassion is part of it. And then encouraging partners in your community to sign on this charter, making a formal and public commitment to the concepts within this, with the proclamation, resolution, or completed action plan. And then step 9 is building momentum by involving other community members, linking to community events, and inviting nearby communities to participate. Educate the broader community about what it means to become a compassionate community, and acknowledge the acts of compassion that are already working within your community. Then step 10, plan and launch a kickoff event to widely publicize your plans. Step 11, begin implementation of action plans around focus areas, and then goes into phase 4, and then 11, 12, 13, 14, 15 are the rest of the steps. So this is an example of compassionate communities that was actually presented within within the article that we were going over. And let's go back to the article just real briefly, and then kind of looking back full circle. So this was all talking about the tangent we went on about compassionate care and understanding is all from interventions that we were looking at. And there's other community interventions in that same website which you can look for. Anyway, drawing our attention back to this research training, and then understanding, which is interesting, understanding clinical practice. So social prescribing is another aspect that was proposed. Also at the community level, enhancing maternal health, including reproductive health, and preventing child abuse and neglect, and treating parental mental illness. Also looking at community capacity building, and wisdom-focused interventions as vaccines to prevent loneliness-related disorders. And this was actually an interesting portion that people wrote about afterwards, and looked at. And so the specific components of wisdom that have been identified has to do with spirituality, emotional regulation, and pro-social behaviors. So that's the three components of wisdom. And using that to create intervention is another good strategy. And then policy implications, of course, looking at interventions such as growing awareness of humanistic and global sustainable development goals. The recent U.S. child tax credit, reducing child poverty by 50%, is one case in point. So making the credit permanent could significantly improve the physical and mental health of today's children through their lifetime. So this has been a fairly long talk, but I think we covered a lot of ground in terms of understanding specific types of social determinants of health that are important and that actually undergird considerations in mental health and the stigma and barriers that still persist within the field, but also some unique opportunities for interventions that can really hone in and address mental health and meet every patient where they are, and better address each individual gap. Thank you for listening.